Hi, I guess you had a dental implant done. Let's go through some home care instructions for you so you can have optimal healing. This is your sheet of paper that's in your bag. It says post-operative instructions for a dental implant. Obviously, if you follow those instructions, you will ensure yourself the best chance of healing successfully. I'll go through some of the highlight. I highlighted it on my piece of paper. I'll go through the ones that I think are most important for you now. As far as activity, take it easy. Rest for the rest of the day. Don't start a new exercise regimen today. Swelling, it probably will swell in that area. That should last and with some bruising for about maybe 5 to 10 days, if at all. If it happens, that's normal. If it doesn't happen, Merry Christmas. But apply a cold pack to this area for 20 minutes on, 20 minutes off, 20 minutes on. Keep alternating all of the rest of the day. 2 hours minimum, but you probably want to do it the rest of the day. Oral hygiene, avoid brushing this area for 24 hours. Don't even touch it with a toothbrush. Afterwards, softly brush that for the next 2 weeks with the soft bristle brush that we've got included in your bag, and some toothpaste, obviously. Let's see, saltwater rinse. You're going to want to take a tablespoon of salt and about this much warm water, stir it around. It'll be milky, cloudy. Put it in your mouth and rinse, kind of not vigorously, but get enough to slop around in there real good for about a minute each time. Maybe 3 to 5 times a day would be great for the next 2 weeks. Discomfort, expect some discomfort. You had oral surgery, it's going to be sore. We found that this combination therapy with ibuprofen and Tylenol, if you can follow that card that's also in your packet and your first dose, you will find that that's a very efficient, effective way to help control discomfort. Diet, don't eat anything harder than cooked pasta on this tooth until we get the final restoration on there. So that's going to be about 4 months. You can eat anything on the other side, anything you want, does not matter. Do not eat anything over the implant for 4 months that's harder than cooked pasta. Super important. You don't want to bump it. Bleeding, yep, bleeding does happen after you've had oral surgery, so expect that after a dental implant. It's normal. It should last maybe a day and mostly just weeping, not so much bleeding but weeping, and we've provided some gauze in your packet too for that, to apply pressure to get it to stop. Numbness, your numbness will wear off in about 2 to 4 hours. That's when the pain will probably come on a little bit. The numbness or tingling shouldn't last for more than 24 hours. If it does, call our office immediately. That's important. Medications, if you're prescribed any, please take those. That's important too. Smoking, chewing tobacco, and vaping, that's a pretty obvious one. Don't do it. Don't do that for at least for the first 2 weeks, but this is a perfect time for you to quit. And follow-up visits. Dental implant surgery was performed today, so it's important for you to return for reevaluation as instructed. That's always dependent on the case, so just whenever we make you an appointment, please keep and follow that appointment. And of course, if you need anything else, call us at 625-7969 during working hours, or follow the instructions at the top of the sheet for which dentist provided your dental x-ray and call them after hours at those cell phone numbers. I hope you enjoyed your procedure and experience here with us, and call us if you need anything. Thank you.